My name's Brian Holmes, and it would have been about 2 years ago now that I was diagnosed with prostate cancer and went through the usual channels of getting checked out and had that confirmed. Was very, very quickly put on the 2-week wait, and I was advised to do that by my local GP. And then the whole care process seemed to really kick off with amazing speed and I must say efficiency and conviction, because I was just sort of swept up and paired with a fantastic specialist. We've tried various treatments ranging from hormone therapy, which had some phenomenal results initially, but then decided that that was probably not going to be the case for the long term. And then we tried rounds of chemotherapy to help remove some of the infection in the bones as well, where it had spread to. The trial that I'm currently, I just can't believe I've actually been given the opportunity to do this, is not only being done for purely personal reasons. It's obviously I'm looking for a little bit of assistance to keep me going for another few years, but it's the tens and potentially hundreds of thousands of chaps similar to myself in my position that it could potentially save.
Hi, my name's Dominique Parslow. I'm a consultant clinical oncologist at Derriford Hospital, Plymouth. The trial's investigating a new treatment for prostate cancer for gentlemen with metastatic disease who have already progressed on multiple previous lines of treatment. It's investigating a type of drug called an antibody-drug conjugate, which is a combination of an antibody which is quite specific for a particular cancer type with a very toxic chemotherapy drug, with the aim of targeting this chemotherapy directly towards the cancer. We don't yet have any drugs of this class for prostate cancer, and this is a first-in-human trial. Our gentleman today is the first patient to be treated in the UK, and the 5th patient to be treated in the world with this new drug.
My name is Tino, and I'm a trainee assistant practitioner in oncology research. We're all super excited to be part of this, as this is just groundbreaking work, and this is basically why we wake up every day and come here.
It's been a phenomenal journey. The team, the whole team that have provided any level of care for me since undergoing this treatment, I just can't thank them enough. They've all been absolutely phenomenal. They've made me feel totally at ease, and I've got nothing but 100% respect, admiration and appreciation for all their efforts.
It's been a very long journey to get to today. Lots of paperwork. It's been very difficult to get trial slots to put people even onto treatment at all. This is always the case for phase 1 trials. It's such an opportunity for our local patients to get a new treatment, which we've got a lot of hope for.
It is a humbling experience. Privilege, it's amazing, being in the right place at the right time. For me personally, this is a rare opportunity, that rare that currently this is my only hope of being able to extend my life by any real period at all. We've had other treatments, therapies, which have worked brilliantly. We're just hoping that this one keeps it under control. The potential of this new treatment is enormous. Absolutely enormous, and opportunities to trial only get offered to a very small number of people, and that's just been so important in giving me the strength to carry on the fight.